COVID-19 in North Carolina. As of today, we've had 889,310 cases, 1,999 new cases reported since yesterday, 1,002 people in the hospital now, and sadly, 11,757 people who've died. We continue to send our prayers to those who've lost loved ones and those who are battling this virus. But our COVID-19 numbers have remained relatively low and stable in recent weeks, and our Secretary of Health and Human Services, Dr. Mandy Cohen, will share more on our improving data in a moment. While our trends look good, we're still keeping a watchful and concerned eye on the more contagious COVID-19 variants we are seeing increasing in our state. Health experts tell us that these variants spread more easily and can even make us sicker. This is another reason why we must keep up our prevention efforts. We still need to wear our masks, take this seriously, and act responsibly. We'll continue emphasizing prevention even as we focus our priority on distributing vaccines in a way that's fast and fair. North Carolina continues to succeed in getting shots off the shelves and into arms. As of this morning, we've administered over 3.4 million doses, and 25.7% of adults 18 and older have had at least one shot, and 16.5% of those adults have been fully vaccinated. That's fast. We're also seeing significant progress with our efforts on equity in vaccine distribution, with an increase in the percentages of vaccines going to people who are Black and Hispanic to get closer to the makeup of our population. And today, the CDC released a report that puts North Carolina in the top 10 states in the nation for equitable vaccine distribution. That's fair. There's still more work to do in reaching underserved communities, but I want to thank providers, community organizations, and others who are helping us expand access to vaccines. Today, we expand vaccine eligibility to even more people. Anyone with a medical condition that puts them at high risk of severe illness is now eligible, as are people in some additional congregate living settings. Other members of Group 4, including other non-frontline essential workers and other people in close group living settings, will be eligible starting April the 7th. And I know people were excited to hear the President's challenge last week that everyone should be eligible to sign up for a vaccine by May 1st. North Carolina will be ready to meet this challenge, thanks to our vaccine team's planning, increased supply we expect to receive, and the hard work of providers administering shots quickly. Last week, I worked with legislative leaders in both parties to pass a law that I signed to get our children in the classroom. We've already seen most schools reopen for in-person instruction, and I'm so grateful for the hard work of our teachers and school support staff who've engaged in remote learning and who are helping students get back into the classroom safely. Please say thank you to these educators when you see them. We'll also hear an update from Emergency Management Chief of Staff Will Ray about some potentially dangerous weather we may experience tomorrow. With more students in the classroom and millions of people receiving vaccines, there is hope on the horizon. But with this virus and its variants that are continuing to spread, it's still too early to let our guard down. We have to keep doing what we know works, wearing a mask and social distancing, even after you've taken a vaccine. Doing these things will help us save lives. Let's keep up the faith and keep up our masks and know that if we do all these things together, we will get through this. At this time, I'll recognize Dr. Cohen to share an update on our COVID-19 metrics. Dr. Cohen.
Thank you, Governor. Good afternoon. As a reminder, we look at a combination of trend metrics to help us make decisions. COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. So as we dive into the data, this first graph looks at the people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. And you can see when looking at the yellow line, it continues to trend downward and is getting closer to our baseline. This is very good news. Next, we look at new cases. This first graph shows you those trajectory of new cases each day since we had our first case back in March of 2020. Now, looking at the yellow line, you can see the cases have decreased since peaking on January the 10th. Let's zoom in, and this next graph shows us the trajectory of cases since just the middle of January. As you can see, these cases have been declining. However, that downward trend looks like it could be starting to slow down and plateau. We'll need to keep an eye on this, particularly with the new variants of the virus that we are seeing in the state. Next, we look at the percent of tests that are positive. This graph goes back to the middle of January. And looking at that yellow line, the percentage of positive tests has been decreasing. Last week, we saw some of the lowest rates of the pandemic. Out of the past 14 days, 9 were below our goal of 5%. On our next graph, we look at day-over-day hospitalizations, and you can see since mid-January, looking at that yellow line, this trend is decreasing. Hospitalizations are now back to where they were about mid-October. Okay, so overall, here's where we are. Surveillance data is decreasing. It's getting closer to baseline. It gets a green check. North Carolina's trajectory of cases is decreasing. However, cases remain elevated, and with the new COVID variants in the state, we need to keep our guard up. It's also important to note that there's a lot less testing happening, which makes this number harder to interpret in isolation of those other metrics. Remember, if you have symptoms, even if you've been vaccinated, you should get tested. So overall, cases gets a yellow line. North Carolina's trajectory in percent of tests returning positive is decreasing and has been under 5% for several days. This gets a green check. And North Carolina's trajectory of hospitalizations is decreasing but still elevated. It does get a yellow line. We are seeing similar positive trends in our counties. This week's COVID-19 county alert system, which you can see in the map at the bottom of the slide, has just one county as red with critical levels of viral spread. Most counties are yellow with significant levels of viral spread. And you can see that this is a big improvement from where we were just a month ago. The next slide shows where we are in vaccination, and it tells a great story. Just over a quarter of all North Carolinians 18 and over are at least partially vaccinated, and 16% are fully vaccinated. That means more than 1.2 million North Carolinians have been fully vaccinated. And as Governor Cooper noted, we are one of the top performers in the nation when it comes to getting vaccines to people from racial and ethnic minority groups and those who are economically and socially marginalized. We're committed to using every lever we have to ensure that historically marginalized populations can easily access a COVID-19 vaccine. That includes how we allocate the vaccine, who we allocate the vaccines to, which events we can support, where we deploy state resources, and who we engage on the ground to help address barriers like transportation and internet access. Thanks to the hard work of our vaccine providers, today those who have a medical condition that puts them at higher risk, as well as people who live in certain congregate settings, are now eligible to get their shots. The rest of Group 4 will become eligible on April the 7th. North Carolina follows the recommendations of the CDC as to who is at higher risk for severe illness from COVID-19. This includes conditions like asthma, cancer, diabetes, heart disease, kidney disease, sickle cell disease, obesity, or smoking. A complete list of high-risk conditions on our website at yourshotyourspot.nc.gov. We are very fortunate to now have 3 tested and safe, effective COVID-19 vaccines that keep people out of the hospital and prevent death from this virus. With improving supplies, North Carolina can get more people vaccinated sooner and meet our goals to provide equitable access to vaccines in every community in the state. This is all good news. However, our work is not done just yet. Keep wearing a mask, waiting 6 feet apart, and washing your hands. Let's keep protecting each other until everyone has a spot to take their shot. Thank you, Governor.
Thank you, Dr. Cohen. I'll now recognize Emergency Management Chief of Staff Will Ray to provide an update on the weather for our state. Will?
Thank you, Governor and Secretary Cohen, and thank you for your continued outstanding leadership. Good afternoon, everyone. Today is day 373 of the State Emergency Operations Center activation for the COVID-19 response. We continue to support our state emergency response team partners with the ongoing COVID response, including the federally supported Community Vaccination Center in Greensboro, where ongoing efforts have provided more than 19,000 vaccinations. We want to take a moment to thank all of our federal, state, and local partners for this ongoing effort in Greensboro, as well as vaccination efforts statewide. This is truly a whole-of-community response to support all North Carolinians. We want to take an opportunity today to discuss the potential for upcoming severe weather. The Storm Prediction Center has upgraded much of central and eastern North Carolina to a moderate risk for severe storms on Thursday, which could impact operations at vaccination and testing sites statewide. The threat of severe weather is greatest along and southeast of the US 1 corridor. However, severe storms will be possible statewide tomorrow. Storms are likely to move into western North Carolina during the morning hours and continue east across the state through the afternoon and evening. Some strong storms may continue overnight Thursday near the coast. Damaging wind gusts in excess of 60 miles per hour and large hail of 1 to 2 inches in diameter are possible with these storms. Strong tornadoes could also develop across the state with this system. Localized flooding is possible, particularly in southwestern counties tonight through Friday and across areas where severe weather develops Thursday. Strong northerly winds could produce minor to moderate sound-side flooding across portions of the Outer Banks and areas adjacent to the Pamlico Sound and Neuse River on Friday and Saturday. Additional beach erosion and ocean overwash will also be possible along the northern Outer Banks. To make sure we are postured appropriately to support any local response to weather impacts, the state will be activating the State Emergency Operations Center for this event and engaging our CERT partners for potential response needs. We've conducted operational readiness checks with a number of our response teams across the state and will continue to monitor the situation along with our local partners. All North Carolinians should continue to monitor the forecast as details and expected timing will be refined over the next 12 to 24 hours. With severe weather expected tomorrow, now is the time to make sure you have several ways of receiving emergency alerts and to review where the safest location at home or work is, such as an interior room or closet away from windows if a tornado warning is issued. Please remember to follow all recommended actions from your local public safety officials. If you need additional preparedness information, please visit readync.org. Finally, as we continue to move through the COVID response, as well as any impacts from severe weather tomorrow, please remember to follow the 3 W's: wear, wait, and wash, and to take care of each other. Thank you.
Thank you, Chief Will Ray. Also with me today is Commissioner of Prisons Todd Ishii. Brian Tipton and Monica McGee are our sign language interpreters. Behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We invite members of the media to ask questions. If you can identify yourself and your organization, we would appreciate that, and we'll take the first one.
Our first question is from Frances Weller with WECT.
Hi, Governor Cooper. It's Frances Weller with WECT in Wilmington, and also greetings to Dr. Cohen. You know, as the push continues to get folks vaccinated, there are those who are simply not going to get the vaccine because, for various reasons, they don't want it. But we're hearing that some companies, such as restaurants, are now telling employees that they are required to get the vaccine. As governor and former attorney general, is that legal?
Well, first, we're recommending that all adults who are over the age of 18 for Moderna and Johnson & Johnson and over the age of 16 for Pfizer to get vaccinated unless there is some special medical issue that you have. It's really important to educate people about getting a vaccine. Yes, we have seen a lot of vaccine hesitancy out there, but at the same time, once people learn more about it, once people see community leaders, doctors that they trust, other people that they trust, tell them that this is safe, then more and more people are coming over. So we want to give as much time for that kind of education. We know that there are a lot of jobs out there that's going to be important for people to be vaccinated because they deal with the public. I know that we're going to be talking with legislators and others about whether vaccines should be required and whether employers can require vaccines. I don't want to get into interpreting the law here at the podium without giving a firm review of all of this. But suffice to say that we're going to be pushing for people to get this vaccine. We know that employees who particularly have to deal with the public need the vaccine to protect themselves and the public, and we're going to keep working with businesses and others to find the best way to do that. Would you want to contribute to that? Okay. Next question, please.
Our next question is from Caroline Hicks with WBTV.
Hi, this is Caroline Hicks with WBTV. Thank you for taking my question. I wanted to see if I could learn more about the vaccine supply and what you guys are expecting as a state as we move into April. We keep hearing the vaccine supply is going to go up. Do you know by how much? And do you know when that would allow the state to open up vaccinations to Group 5?
Well, first, we're continuing to be encouraged by what we are hearing from the President's administration. We are in constant contact with them. One of the things that we as governors ask the administration is for a better runway so that we can see what's coming down the line so that we can prepare. And we will be getting increases in the number of vaccinations, which has so far allowed us to open up groups earlier than we had expected, and we hope that continues to happen. But I'll let Dr. Cohen address that specifically.
Hi, Caroline. To build on what the governor was saying, so our vaccine supply has really steadily increased over the last 8 weeks. We were getting about 120,000 doses at the end of January, and going into this week, we're doing about twice that, so about 240,000 vaccines are coming into the state. But remember, that's just the state allocation. There are also additional channels that the federal government has added. For example, going to our retail pharmacy partners. So we know every Walgreens and some of our CVSs in the state of North Carolina have vaccine. That is above the allocation that comes to our state. We know vaccines coming to our FEMA site in Greensboro that was mentioned, for example. It's going to our FQHCs, or Federally Qualified Health Centers. So there is vaccine coming in a number of different channels. But in terms of what is coming to us, again, we have seen that doubling over the last 8 weeks in the Pfizer and Moderna. And it is really the Johnson & Johnson supply that is really going to pick up in the month of April that will, I think, allow us to further accelerate our efforts. Right now, we got a one-time allocation of Johnson & Johnson vaccines the very first week it was authorized. That was about 80,000 doses. We've gotten just a small amount, about 10,000 doses since then. But we have been forecasted by the federal government to be receiving more of that Johnson & Johnson vaccine end of March, beginning of April, and then every week going forward. So I think that will take us from about 240,000 into 350,000 range every week. So as the governor said, we hope to be able to continue to work through our eligibility groups and stay on track for President Biden's goal of having all adults be eligible by May 1st. Thank you.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. I have a couple of questions, one of which I just wanted to make sure when you're talking about the members who will not be eligible for Group 4 until April 7th, are they still those essential workers who did not meet the criteria for being considered as frontline? And then the second question is, as we're seeing more vaccine coming in and we're seeing more vaccinations, how are you putting that into perspective when it comes to reopening the economy and including the reopening bills that are in the legislature?
For Group 4 on April 7th, more of the essential non-frontline workers will be eligible, but I'll let Dr. Cohen address that specifically. And we are very hopeful as we look toward the order that ends not this Friday, but next Friday. Our numbers continue to improve. We've said from the get-go that we're going to follow the science and the data. We have been by easing restrictions over the last couple of orders. We hope to do that again this time as we continue to see improvement in our numbers. And you know, more and more people are getting back out and doing things, and that's positive. It's positive for our economy. We just want people to make sure that they are careful and responsible to get vaccinated. The more people we get vaccinated, the better off we're going to be when it comes to looking at these numbers and preventing serious illness and death. And the more people who are careful, wear a mask, and do the things that they need to do, the better off we'll be. But I'll let Dr. Cohen address a little bit more about the Group 4 and what's coming up, and then that other issue if she wants.
Hi, Richard. So yes, starting today, those in Group 4 who have a medical condition, an underlying medical condition that puts them at higher risk for bad outcomes from COVID, are eligible for vaccine. And I read a long list. It's everything from diabetes and cancer, heart disease, lung disease, to obesity or smoking. So I would encourage folks who may have an underlying medical condition or may be obese, smoker, or other to really look at those conditions and see if they are eligible. We've talked throughout this year of COVID where we know that half of adults in North Carolina have a medical condition that might put them at higher risk for COVID. So we know this can be a large group. So we hope that folks will take advantage of the fact that they are now eligible for vaccine and go and get an appointment. On April the 7th, we'll move to the second part of Group 4, which includes additional frontline essential workers. These are potentially those in some of the industries that were already available, but they may be people who can work from home. They would become eligible, and other kinds of essential businesses. Again, you can go to yourspot.nc.gov. You can go through a number of questions, and that they will ask you about your employment, and that will funnel you into the right group to know whether or not you would qualify as the part of Group 4 or whether or not you would be in a Group 5. Thank you.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. So it's been a year since North Carolina's been under the state of emergency, and as you mentioned, the current executive order expires next week. So what can you tell people now so they can make plans, since Easter and Passover are coming up, about what kind of restrictions will be lifted next week, and also what the benchmark is if May 1st being open for vaccine eligibility, if that's tied to restrictions so people can make plans?
Well, thanks, Dawn. As we've said all along, that we look at a combination of data metrics to determine where to go with easing of restrictions. And as I mentioned earlier, we are very hopeful that in the next executive order that we could see additional easing of restrictions. I think the structure of how we have set out these restrictions have been positive for North Carolina. It has resulted in positive health results for our state. Our economy is continuing to grow and moving in the right direction. So we feel confident about where we are and look forward to announcing that next week to talk about what's going to happen on Friday. Next question, please.
We have a follow-up. Dawn Vaughn, News and Observer.
Thanks for the follow-up. And I know you just said next Friday, but people are asking ahead of time. It's a week and a half until Passover and Palm Sunday. Clergy are asking what to do as people are vaccinated. What can you tell them today instead of right as the order is expiring?
So as I mentioned earlier, we are hopeful that we can ease restrictions even further in the next executive order. We're going to continue to look at the data the rest of this week and through the weekend and the first of next week, then analyze all of that data and make decisions on what that needs to be in consultation with our health experts and in our continued conversations with businesses throughout North Carolina who have contributed greatly to the kinds of protocols that we have put in place. So we're very hopeful, and also as more people get vaccinated, that does figure into what we're doing. We know that more people will be protected. At the same time, we want to continue to tell people to wear masks and be responsible about what they do, because we have these variants out there. We've seen some spikes in some other states and other countries. We don't want to see that here. That's why we don't want people to let down their guard. Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Brian Anderson here with the AP. Had two questions for Dr. Cohen really quick. We know that if you live in a congregate setting, such as a frat house or a dorm, you can get vaccinated starting April 7th, but there's many people who are college students who live at home and then attend these super spreader events. Would you consider opening up eligibility to any college student on April 7th? And then my second question is, North Carolina has been widely praised for its robust list of 18 different health conditions. One of them that isn't on there that I've seen some attention to is allergies, particularly people who are allergic to antibiotics, which could present a concern if they became infected. Would North Carolina consider adding any additional conditions to its existing list? Thanks.
Sure. First, on the congregate settings, you're right. Starting on April 7th, we folks who do live in congregates, other kinds of congregate settings, will be eligible for these vaccines, and so that does pick up a large number of our college students. I think that as we've been talking about today, between April 7th and May 1st, which is the goal set out by President Biden, I think we will be able to open up to all adults, and that would include other college students. So I think we're talking about just a number of weeks here between the two groups. So we want to prioritize those in congregate settings. We know that's where the virus spreads fastest. So that is why we're doing that prioritization. But again, I don't think there's going to be a huge time difference between April 7th and making President Biden's May 1st deadline. And it may be possible that we can go even sooner than May 1st. We'll have to look at supply and demand and talk with our vaccine providers about that. And as far as the health conditions, again, we follow the guidance of the Centers for Disease Control. It is their list of health conditions that guide our efforts in terms of understanding which are those that increase someone's risk for disease. I have not heard that anyone with allergies, seasonal allergies, or allergies to antibiotics be someone who is at higher risk from COVID-19. I'm happy to take that back to our clinical team and see if there's anything we need to look at, but we would probably go back to the CDC and see if that is something that they are looking at, if they are going to add that. So we will consider that if that's something the CDC will end, but I have not seen that in the research and the data in terms of putting that being a risk factor that would have worse outcomes for someone with COVID. Thank you.
Next question.
Our next question is from Reuben Jones with Spectrum News.
Hi, good afternoon. This is Reuben Jones from Spectrum News in Charlotte. I wanted to ask you about Group 5 as we get coming up to May 1st here. Do you expect that to all still happen at once, or do you expect there to be any sort of splitting of Group 5, whether it's 55 and older or anything like that, prior to the May 1st deadline?
I know that we have continued to see an increase in the number of vaccines that we get, and I know that we constantly monitor what our providers are seeing out there. We want to be able to provide openings as soon as we possibly can, and we take all of that into account. But I'll let Dr. Cohen address that specifically.
Hi, Ruben. At this point, we do not anticipate further splitting out of Group 5, which would be all other adults that have not all previously gotten vaccinated. But I think, again, as the governor said, we need to understand the supply that we're seeing at the time, the demand, and do we feel like we need, do we feel like our vaccine providers will be overwhelmed with demand if we open to all right away? I think that with opening to those with an underlying medical condition that puts them at higher risk for COVID, and that opens today, we do capture a lot of adults across North Carolina. As I said, we know that half of adults in North Carolina have one of these underlying medical conditions. Many of them are over 65 and frankly already vaccinated, but we do believe that this picks up a lot of folks under the age of 65. So by the time that we are opening to all adults, we do believe that we won't have to further sub-segment Group 5, but we'll have to see what the supply looks like and what our vaccine providers are seeing on the ground. But at this time, we don't see a change coming.
Next question, please.
We have a follow-up, Reuben Jones, Spectrum News.
Thank you. I think this next question might be best for Secretary Cohen. I was recently spent a lot of time with some members of the indigenous community in North Carolina, and every person I spoke with pretty much was not planning to get the vaccine. As you know, North Carolina has a very large Native American population. I think it's largest state with it, east of Mississippi. I'm wondering if this is something you're coming across, and if there is a plan to, specifically help ease some of that concern that has been with the government from Native Americans for obviously centuries now.
Well, Reuben, thanks for bringing that up. I was just with the Commission on Indian Affairs last week talking about the importance of vaccines, and there's been great partnerships across the state on making sure that we can get vaccines out equitably. That means to our African American community, our Hispanic Latinx community, as also our Native American community. So we are working across all of those. And I also want to mention that there is vaccine availability in various ways. So the Indian Health Service is another mechanism in which folks can also access vaccines through our federally qualified health centers, and as well as our partners in counties like Robeson County, I know, are doing specific vaccine events that are focused on our American Indian population. And so there is a lot of work going on to make sure we're having folks understand what vaccines are, how they work. There was some really good discussion about the need to continue to get that word out, and I was grateful to have the opportunity to address the Commission on Indian Affairs last week and get their partnership in working to make sure that vaccines get out quickly. Thank you.
Next question, please.
Our next question is from Jonah Kaplan with ABC 11.
Governor Cooper, Dr. Cohen, good afternoon. Thanks for taking the questions. Jonah Kaplan from ABC 11. Twice now you've moved up the calendar because we've had increased supply. Is that also because, though, if there's increased supply, maybe there's plateauing demand? And if there's plateauing demand and we don't reach herd immunity, well, then what?
That's a good question, Jonah, and it's one that I was just having a conversation with Dr. Cohen and other health officials about. Right now, all of our appointments for vaccines are filling up and people want them, and we're reaching out to communities. But we still know that there is a lot of hesitancy out there across the board, and we're going to have to, at some point in this process, really work toward convincing people that this vaccine is safe and effective, because it absolutely is. The more people who get vaccinated and the more people that who've gotten vaccinated, the more likely people are to change their minds and to say, okay, I'll get a vaccine. I've seen it happen personally with people, and I've heard lots of stories about it, and I think some research backs that up. But we're going to be working extraordinarily hard to convince people that this is important to do. And I know at some point, as we increase supply, that we're going to really be working to try to get a greater percentage of the population vaccinated to people who don't want it. I think Dr. Cohen says that covers it. Next question, please.
We have a follow-up, Jonah Kaplan, ABC 11.
Thanks again for that answer. My second question really is about the vaccine and. It's been wonderful that we have these vaccines, and yes, attention should be made to them. It's important. It's critical. I'm very blessed and grateful that I got mine. But how important also is your physical safety? And as the sun comes out, fighting obesity, getting healthier, what role does that have in also protecting you from viruses like COVID-19 or the coronavirus that causes COVID-19?
I'm going to let Dr. Cohen address it, but I'll preface that with this comment. We know that during this pandemic that many people have let other health conditions go unattended to, and many people have not engaged in preventive care like they did before. People have had trouble overeating, not exercising enough, and potentially other diseases or problems they might have gone undetected. So it's going to be absolutely critical that as we get back into the swing of things, that we pay attention to these health issues that are in front of us. It's one of the reasons why I'm pushing the legislature to allow us to step into this open door that the federal government has given us to expand Medicaid to 500,000 to 600,000 people. A lot of people have lost their jobs during this pandemic and therefore have lost their employer-sponsored health insurance. We're going to have to pay attention to people's mental health, to opioid abuse. All of these things are going to be important. And I will let Dr. Cohen opine on how much that helps protect you from the virus in addition to vaccines and being careful. Dr. Cohen.
Well, the governor covered that very well in terms of the fact that we know that the healthier your body is, the better you are at fighting off COVID. It's why we are seeing those with obesity or with underlying lung damage because of smoking. Those are things that put you at higher risk for bad outcomes from COVID. So there has never been a better time to make sure that you're doing everything possible to put yourself in a healthy position to fight off COVID. Even with a vaccine, we know that we want to be healthy for so many reasons. I want to point out what Governor Cooper was saying about mental health. We have learned, because we've had, unfortunately, hurricanes and other natural disasters here in our state, that often the impacts of mental health are seen after the crisis. So as we emerge from this, we are going to be particularly attuned to the mental health needs here in North Carolina. But I say it goes back to also having that insurance card and that access point in to be able to seek the help that you need. And we have the opportunity to get 500,000 to 600,000 people that access card and that insurance card, and by saying yes to Medicaid expansion. So you're going to hear us talk about that a lot as a really important component to our recovery efforts overall. Thank you.
Next question.
Our final question is from Derek Dellinger with Fox 46.
Yes, this is Derek Dellinger with Fox 46. Thank you for taking my call. I have actually two questions. I'll just go ahead and ask the first question first. As far as this May 1st guidance from the president, is this moving up any plans the state may have as far as any resource allocations or any plans to actually get more people to get involved in the vaccination efforts? Is that rerouting anything? Is that causing things to be moved up? Is that affecting anything that the state is doing right now to actually get the vaccination effort out?
So to answer that question, no, I don't believe so. We are looking forward to having vaccines open to all adults by May the 1st. It would be great if we could get there even faster than that, but I think this is a reasonable challenge by the president, and I don't think that there's anything that we're giving up by trying to get there. And she would agree with that question. So next question, please.
We have a follow-up, Derek Dellinger, Fox 46, for our final question.
Yes. There is a perception of a lot of the COVID response over the last year, and this goes back to what Don Vaughn with the News and Observer was asking a little bit ago about the planning out. The short-term planning has been kind of the big theme of the last year or so. It's week by week or a couple of weeks out or a few weeks out. Are we at a point right now where long-term planning on the COVID response it can become the norm, or is it going to be becoming the norm very shortly as far as the forecasting and that the state has been doing?
Absolutely. And as you saw, the last executive order was for a month period, and we're already planning our pandemic recovery, how we're going to help the businesses that have been hurt the worst by this. We're getting so much response from businesses all over the world about being very interested in coming to North Carolina or expanding their number of jobs here. So I feel very positive and confident about where we are. The more people we can get vaccinated, the less we can worry about this virus, and the more the time that we can spend on getting our children educated, getting people trained for good paying jobs, making sure everybody's covered with health insurance, making sure we get high-speed internet access all across our state, making investments in capital. I'm looking forward to presenting my proposed budget to the General Assembly, hopefully sometime next week, to let them know specifically what we have been thinking. I've had some early preliminary discussions with the General Assembly there. So yes, we are making long-term plans on recovery from this virus. Our data looks really good at this point. We still need to keep up our guard and keep our masks on and be responsible and get people vaccinated. But I believe that we can emerge from this pandemic even stronger than we were before if we continue along this path. Thank you guys so much for being with us, and stay safe out there.